Good afternoon. This is Senate Education. It's Tuesday afternoon, March 9th at 1:30. Committee, welcome back. Hope everybody had a good week. I'm sure it sounds like they were productive weeks for everybody, not necessarily much relaxation, I'm afraid. Just to get, sort of recap, as well as talk a little bit about what is going to be coming this week. I thought I'd start by reviewing for those watching as well as for all of us. We passed 3 bills out prior to recess: miscellaneous education, S13, and literacy bill. Those bills will be, I know that S16 was directed to appropriations today. The other bills will be on the calendar tomorrow, both of which go to appropriations, and miscellaneous education may also go to finance. For those who are reporting on the floor, Jeannie will provide everybody with a witness list. I will also provide everybody with fiscal notes, as I'm sure the money committees will as well. And happy to support and help anybody in any way as they get ready for their floor reports. It's interesting. I wouldn't consider, I certainly don't consider myself actually far from being, one of the stronger ones on the floor. But some of the best advice I ever received was talk about it like it's a problem that you want to solve. Here's the situation. Here is the solution. So that's just one way for those of you who are thinking about floor reports now and going forward. Bringing us to this week. I'd say there are our final week before crossover. There are a number of things that we're going to be looking at and seeing what we might get done. H81, which we had a walkthrough of last week or the week prior to our departure. We are going to continue and take testimony on that today. That testimony will be interrupted for a little while by S100 because of scheduling, and then we'll return to that. S100, for those of you who don't recall, that is the bill that was sent over to us by Senate Agriculture. We'll do a walkthrough, hear from the agency on that, and then we will also hear from the 2 members of the committee, Senator Pearsons and I believe Senator Collmore. Then we'll return to H81. And then later in the day, prior to our adjournment, we will look at S13, and this is the weighting study. What I have done and want to put before everyone this afternoon is during the break, I collected a number of different questions. I know the Pro Tem's office did as well. Some Senate colleagues sent me questions around what might we start to look at as it relates to S13 to kind of keep it going. Is there a way to frame some questions, get some work done this summer around the weighting study, given the time that we're under right now? So what I want to put forward to all of you later on to consider, it'll be the last thing that we work on, is a draft amendment to S13 that I'd like you all to consider and give some thought to. I think a lot of senators have heard from constituents, from other colleagues. There's genuinely, or generally, I feel interest in moving the weighting study work forward, knowing, given the situation that we're in right now with the pandemic and some of our other priorities, not only in this committee, but other committees, instituting all the research that has been done doesn't seem to make the most sense, particularly since there are several questions out there. And what I've asked Jim to do later today is take us through some of those questions that I've heard and see if we can come up with a group that might work on this over the summer, and then something that we can return to next winter. Other things that you'll be seeing this week, in addition to S100 and H81 and the weighting study, we still need to share with appropriations some language that they would put in the expedited budget bill around what summer program language. You may recall from the letter that we worked on together and sent to appropriations, we requested funding so that students could have a summer that is enriching, restoring, something that kids can connect with other children, and start to for lack of a better word, heal after having, had a less than ideal academic school year this year and the end of last year. So appropriations has asked us for some language, some guardrails, some language that they need around the distributing of those funds. And I'll share that with an idea with everybody tomorrow. I don't think it'll come to as much of a surprise. We started looking at some of this language a few weeks ago. So with that, the only other thing I want to mention is that this is the last week before crossover. We may have some later than usual evenings. I certainly am doing my best to make sure that they're not too late. But today, for example, chair's meeting was pushed back until 5 o'clock, giving all chairs an opportunity and committees an opportunity to continue the work that we've started and work that we need to finish. So please know that. And I think there may be a couple of other sort of after 5 o'clock meetings this week. So stay tuned. Feel free to be in contact with me with any questions or concerns. I also recognize senators are being pulled in different directions into other committees, other meetings right now, given it's the last week. So I recognize that that may happen from time to time as well, and would just appreciate a heads up when you can provide it. With that, senators, any questions? Okay, all right. Thank you. So let's move into H81. This is something, again, that we started talking about the week prior to our departure, that Friday. This is an act relating to statewide public school employee health benefits. We have heard from Jim Demaray, our alleged counsel. Today, we are going to hear from school board members, and as well as, I believe we are also going to hear, yes, later on from Jeff Fannin, the executive director of the NEA. So with that, I'm going to turn it over to Ms. Burkhart. Ms. Burkhart, there you are. Welcome to Senate Education. We have about a little less than an hour, given that we do have Secretary French coming in. Actually, we have Secretary French coming in at 2:15. Well, let's backtrack. We have to start taking testimony on S100 because of scheduling at 2:15. We will return to this topic at about 3:15. So those of you who might have to jump off and then jump back on, I apologize, but we have to work around, and understandably, other people in the agencies and our attorney's schedule. So with that, Ms. Burkhart.
Thank you very much, Senator Campion. Thank you to all of the members of the Senate Education Committee for taking the time to hear testimony on H81. The key points that I'd like to make today are, one, that the rising healthcare costs that we are experiencing in Vermont are crowding out opportunities for students and increasing operational risk in school districts across the state. Number two, one important reason for moving healthcare negotiations to the state level was to balance cost containment with appropriate access to healthcare benefits for school employees. Number three, since districts no longer have the ability to negotiate healthcare benefits, we're relying on the commission to do so. And it is important to districts that cost containment is at least considered when determining which last best offer to choose if the process comes to that. At the very least, the arbitrator should have the appropriate data in front of him or her when making a decision that will impact school districts in every community in Vermont. So we urge you to make sure that the arbitrator has that information by amending H81 as suggested in my written testimony. To illustrate these points, I'd like to share with you some information regarding the impact of rising healthcare costs in the South Burlington School District. Healthcare costs have been rising over the past several years. Monthly premiums have gone up by double digits or close to double digits in each of the past 4 years, 10.1%, 11.8%, 12.9%, and finally for FY22, 9.6%. Annual premiums did go down in FY18 and 19 with the introduction of new high deductible plans. However, the state clawed back hundreds of thousands of dollars of those savings during each of those 2 years, meaning that local taxpayers saw little benefit from shifting to the new plans. The structure of the health reimbursement arrangements negotiated across the state has contributed to significant increases in the cost of the health plans. As of FY22, if the announced rates are approved, premiums will be higher than they were under the old low deductible plans, and the district will be on the hook for 84% first dollar of out-of-pocket expenses ranging from $2,500 for a single plan to $5,000 for the plans that include more than one member. The arbitrator's award is particularly problematic for South Burlington. Teachers and staff in our district were paying first dollar out of pocket, and the award changed that to last dollar. The most exposure any employee will have to out-of-pocket expenses will be $800, no matter how many family members are included on their plan, and for single teachers, no more than $400 per year. The change to first dollar out of pocket and higher premium rates meant that as the district prepared its FY21 budget, it expected healthcare costs to increase by $1 million or 17.7% versus FY20. That represented a 2% of the FY20 budget. So in other words, before we could even talk about salary increases or additional programming for supports for our students or maintenance of our aging buildings, we were starting with a 2% increase in our expense budget for FY21 out of the gate. For further context, our expense budget had gone up on average 3% over each of the previous 8 years. Given increasing enrollment, increasing needs for a range of services amongst our students, and a range of other pressures on the budget, the initial proposed budget had an increase of about 8% in expenses. Unfortunately, for the children of South Burlington, taxpayers soundly rejected both our initial budget and a large bond that we had proposed to fund the rebuilding of our middle and high school campus. The pandemic hit just after the first vote, causing additional anxiety in the community regarding the budget. It took us 2 more votes to pass a budget that finally came in at an increase of 1.52% in expenses. After staffing cuts in the final revised budget, the district expects to pay $842,000 more in healthcare expenses in FY21 than it did in FY20, an increase of 14.4% and 1.63% of the FY20 budget. So how could we pay 1.63% in increased healthcare expenses, but only have a budget increase of 1.52%? It required a very painful process of cutting back the budget and then cutting it back some more. Administrators were asked to create a list of potential cuts and prioritize them according to those that least impacted student experience directly first, and then moving on to more and more direct cuts to student programs and supports. The board, administration, and community used that list in a series of meetings to discuss the consequences of each potential cut and to pare back the budget. In the end, the cuts were extremely impactful. $830,000 in programming and service reductions. This impacted things like athletics and student activities at the middle and high schools. We reduced math and literacy coaching at the elementary and high school levels. There are fewer emotional supports and social emotional supports for the kids this year, despite what's going on with the pandemic. Driver's education got cut back, which impacted families with fewer financial resources more heavily than those families that didn't, because it meant longer waits for school provided driver's education. So kids are going to have to wait longer to get their licenses, and some won't get them until their senior year. Family and consumer sciences at the middle school was cut. Arts education, business education, and health education all took cuts. The Big Picture program, which is a unique flexible pathways program in the high school, has room for fewer students, and certain AP classes were cut back. AP European History, AP Chem, and AP Calculus BC is only being offered remotely. In addition, we had to make $1.1 million in operational cuts, which increases our operational risk as a district in a very tough year. Fewer HR staff, fewer IT staff, fewer transportation staff have all made people's jobs very, very challenging this year, especially given the pandemic. In addition, we cut back $1.3 million in previously proposed new expenses. Our administrators and our non-union support staff took salary freezes. We reduced contingencies and negotiations for teachers and support staff who we were still working with to get contracts in place. We hired fewer new teachers than we had hoped to in order to address enrollment growth at the elementary schools. And we delayed a lot of purchases of software and other maintenance on IT and buildings. Taxpayers will not continue to support education budgets that are growing significantly faster than their own incomes. Given that we are limited in what we can ask in terms of increases from the community, it becomes a matter of resource allocation. If healthcare costs continue to grow faster than our overall budget grows, healthcare will take up a larger and larger percentage of our budget. In FY19, it was budgeted at 10.7% of total expenses. For FY20, it was 11.3. For FY21, it was 12.8. And in FY22, it's projected to be 13.3% of our overall budget.
Ms.
As
Burkhart,
healthcare, yes.
may I just step you right there? I'm sorry to interrupt, but you're on a really interesting point that I would love for you to pull apart a little bit for us.
Yes.
If I'm understanding you correctly, you believe that H81 in some ways, as you talk about healthcare costs,
Yes.
would not allow for the controlling of healthcare costs that Act 11 does allow? Can you just help us out? I mean, it sounds to me like you're talking about, and correct me if I'm wrong, please. I'm trying to understand this as much as everyone else. You're talking about healthcare costs.
Yes.
Healthcare costs aren't things that, from where I'm sitting, the state can really control a lot. But it sounds like there's something that's happening now that is allowing for the control of healthcare costs. But then H81 might come in and deter that.
I would actually say that Act 11 did not go far enough in controlling healthcare costs, and H81 does not then add to that element of cost containment. So we're not saying that cost containment should be the only thing that's considered, but there needs to be some balance between access to appropriate benefits and cost containment. So what happened, very simplified, and other folks who are testifying later might add some color to it.
Right.
In Act 11, as you know, the process between the employers and the employees came down to an arbitrator's decision. And that arbitrator was told that they needed to choose one side versus the other. They couldn't sort of pick and choose different elements of each side's proposal. He had to take one last best offer or the other. And there was no mandate in Act 11 that he consider cost containment as one of the elements that he was reviewing when he was choosing those offers. He really had to make a choice between those two offers. What we're saying is that H81 should be amended to make sure that the arbitrator has the right information in front of him or her to understand what the impact on the overall cost of healthcare will be for each side's proposal. That's where our concern really is about H81. And that's why I'm dwelling so much on what healthcare costs are right now and how they're rising. Part of the problem, as I glossed over at the beginning, and I think Laura Suarez will hit it a little bit more in detail in her testimony, is that the way HRAs are structured in the current health plan, the one that was chosen by the arbitrator, it doesn't really provide incentive for employees to focus on their healthcare and become educated consumers of healthcare. And so because people are using healthcare without any impact to their wallets, really, it is driving up the cost of the health plans themselves. So the structure of that final decision by the arbitrator, if that's what it comes to, and it given our past history, will likely come to that. We just want to make sure that the arbitrator is at least considering what the financial impact is going to be for districts across the state when they make that decision.
Thank you. Questions for Ms. Burkhart? Senator Hooker.
I do have a question. Thank you. Thank you, Bridget. So you don't feel that because of Act 11, arbitrators will have the information that they need? I mean, they have they're asked to look at the negotiations with a view towards, the impact that it's going to have on the ed fund, on the school districts. So what other, I guess, where else would the information come from? What other information?
So in my written testimony, that was part of the letter that I sent to all of you, what we're asking to be added to H81. So there's a section of H81 that reads, in reaching a decision, the arbitrators shall, and then the new language we're asking for is determine which of the two submissions most appropriately balances appropriate access to healthcare benefits and reasonable cost containment to ensure financial sustainability of the plan. The arbitrator or arbitrators shall also give weight to the evidence, documents, written material, and arguments presented, as well as the following factors. And then two additional factors that we would like to see added are number 6, the actuarial value of the health benefits for the full term of the award proposed by each party as compared to health plans available through Vermont Health Connect. And 7, the percentage increase or decrease in education spending that is likely to occur under either party's proposal for the full term of the award as compared to overall economic growth for the state of Vermont. So basically what we're asking for is to do a little bit more analysis of what the long-term, the full cost over the term of the award is going to be. We just don't feel that that was appropriately considered in the last round when the arbitrator made the decision.
Okay. Thank you.
Other questions for Ms. Burkhart? Witnesses, please, going forward only because, as you can imagine, the volume of emails and testimony we are making our way through. Please don't assume that we have read all of the testimony. If you would please just kind of go back to what I consider the, as I mentioned, I think you were all here when I said, the best way for a presentation sometimes in the Senate is former Senator Bill Doyle's process, which is, here's the problem, here's our solution. This is what we're seeing. This is what happened with Act 11. This is why things may have gone well or didn't go well. H81, these are some of our concerns, and this is what we believe to be a possible solution. So I would just, if I may, give everybody that guidance, and I think that will help us. Senator Chittenden.
So thank you, Chair Burkhart, for being here today. What I've seen as an argument to question some of the language you put forward is that the other 3 statutes on hand for negotiating with labor does not have this rigor, this degree of cost emphasis. Why would you argue that the healthcare negotiations demand or are worthy of these additional thresholds, hurdles, or bars to achieve when it comes to consideration of costs over and above what's already in Act 11 and already in statute?
I would argue, just because I would argue that the results of Act 11 so far would demand a higher bar. We didn't feel like the arbitrator gave us any real reasoning in his decision. He just sort of chose one side or the other. We didn't feel as districts that we could explain it to taxpayers. We didn't really have a good sense of why that decision was made the way it was. And now that it's out of our hands, we are having to basically move our budget around whatever comes down from that negotiating process. And so we've essentially entrusted a very big part of our negotiations with our employees to the state. And we would like to see that level of analysis to make sure that they're acting in the best interest of the districts.
Senator Lyons.
Thank you. First of all, you have pointed out what we all know about the rising costs of healthcare, and we appreciate that. My question is, couldn't you, as a negotiator, provide the information that you are asking for? So if there was an interest in having an actuarial analysis on the proposals, either or both of the proposals, isn't that something that you could prepare and offer in as evidence during the negotiation process?
I would defer to some of the later folks, Joe McNeil, or I believe Elizabeth Fitzgerald, who's on the commission, will be testifying in the second part of the day. I would defer to those who are actually in that negotiating process to give you better color about how information is considered or not considered by the arbitrator. I don't know if Joe wants to take that question now, or if we want to wait for Elizabeth at some other point.
Mr. McNeil, would you like to take that question? I'm afraid you're muted, sir. Now you're unmuted. Yep.
Thank you, Mr. Chairman. Senator Lyons, the quick answer is that, yes, you're right. That information could be presented to the arbitrator, but that doesn't mean necessarily that the arbitrator would take it into account in the decision making. The decision that the arbitrator gave in round 1 was essentially, I've looked at both parties' submissions, I compared them to the statute, and I'm picking the union side because I think it's closer to the statute. That was the depth of the analysis. And what we're looking for consequently is not only the submission of the information, but the fact that it would be taken into account in the decision-making. And that results in the two components that Chair Burkhart was talking about. Number one, indication that there should be a proper balancing of cost containment with access considerations. And then number two, the criteria that she went over.
Thank you. Other questions for Ms. Burkhart? Please, Senator Purcell.
Just on that point about the decision that the arbitrator gave, or what we were calling last thing is like the non-decision, because it was just a couple sentences. But my understanding is that is corrected with H81 separately from this question about the healthcare costs. Am I not right?
You're correct, Senator Perchik, that the bill does now require the arbitrator or arbitration panel to give what's called a full explication of their analysis. So that part is correct. What it doesn't do is add that the analysis would take into account this balancing that we're requesting and the specific criteria like the impact on education spending and the AV values of the plans.
Just to follow up, Mr. Chair. I mean, I understand what you guys are asking for, but I think it's difficult. And I guess I don't understand why what's in there now is not sufficient, where it says that the financial ability of the fund and the school districts across the state to pay for the cost of healthcare benefits and coverage. Like, why isn't that sufficient? They're obviously, the arbitrator has to, well, hopefully you guys, the parties will just negotiate it and we won't have to go to the arbitrator. But if you do go to the arbitrator, then why isn't just like saying you got to take into account the costs of these healthcare programs? Why is that not sufficient? Which is
again, respectfully, the first round, even though most of those criteria were present, did not result in a decision which reflected any analysis. And we had between the two parties, there were like 3 or 4 long days of testimony, at least 2 of them going from like 8 in the morning till 10 at night, with a great deal of expert analysis made available. And then there was a dearth of analysis that we saw. So, and we're reflecting back on Act 85, which preceded Act 11, and thinking that the basic balancing here is between trying to make sure educational employees do have access to quality health care on the one hand, and number 2, that we've got a plan that is sustainable and with reasonable appearance of cost containment. And we're hopeful that that basic, if you will, philosophy that was Act 85 into Act 11 into the commission is reflected more concretely in the bill.
Other questions for Ms. Burkhart? Senator Chinden, please.
I have to leave after this question, but maybe it's to Mr. McNeil or maybe to Chair Burkhart. I've heard in what you said, Chair Burkhart, that the reason to go to a statewide negotiation for healthcare wasn't just cost containment, that it was also for equity and also for higher quality of negotiated services for maybe the same price. Is that the general sense of why we went to statewide, or was it in fact a cost impetus that the healthcare costs are rising so highly that this was entirely taken upon in order to contain costs, or was it multifaceted in why we went to a state healthcare negotiated contract with our teachers?
I can give you my opinion. You might want to ask opinions of other folks who are testifying. I think cost containment was the big reason. That was the big push. But I do think that there was a dramatic difference between districts in different areas about what they were providing or not providing. And I do think to a certain extent, it was to make sure that all school employees were able to access healthcare appropriately. Not that anyone wasn't getting healthcare, but the terms of that healthcare varied widely across districts. And I think this was meant to a certain extent to be an act of fairness to bring those into balance.
Thank you. That's very helpful. I need to depart, but I'll be back around 3. My apologies.
Okay. Ms. Soares, am I pronouncing your last name correctly?
Yes, thank you.
Great. Thanks for being with us. Before you start, I'm wondering if you would please tell the committee what would happen. Give us a couple of scenarios of what would happen if H81 passes.
As it is today.
As it is today, the governor signs it. What happens?
Well, I think that it will have made some improvements of Act 11.
Okay, that's good to know.
I think it will perhaps give a false sense that balancing costs is not a critical component that needs to be taken into account. And it may lead to a lost opportunity to control health costs to a degree. Now, my testimony, I realize, might be interrupted and need to be broken into 2 parts, but one of the things that I wanted to speak about is that the decisions made by the committee does have the potential to slow healthcare increases or to speed healthcare increases. There is a direct connection to the out-of-pocket cost HRAs that are shared or determined by the commission and future premium increases. So I worry about lost opportunity, and I worry that we've given a message that cost is not a critical component. One of the things that I expected from a state commission was that a group of 10 thoughtful individuals would be able to delve into the long-term statewide implications of their decisions in a way that hundreds of school employees and local union leaders aren't able to in making healthcare decisions. So we saw uneven healthcare decisions, and we saw healthcare decisions that, it's the tragedy of the commons concept where everybody makes a decision that makes sense for their own local entity, but taken together actually is a challenge for the state as a whole, the community as a whole, the education fund as a whole. So I expected the commission to be more thoughtful and to take into account some factors that I think this law has the opportunity to emphasize as important.
Thank you.
So,
Please, Senator Hooker.
so to follow up on your question, Senator Campion, so what happens if we don't pass this law, this bill? How are the people who the bill is intended to help, how are they affected? How are the lower paid ed employees affected if the bill doesn't pass?
So, and maybe I can speak to some of my written testimony that could sort of help with that. But one of the changes that this makes is that premium share does not have to be the same across all school employees. The current law requires, Act 11 required, 1 transition round, which we just completed, and then everyone have the same premium share. And it also requires, without this bill, that everyone would have the same out-of-pocket cost share. Now, people have had the same out-of-pocket cost share until 2021. And I can speak to that. And before VI had new health plans, everybody had the same out-of-pocket cost share in the health plan. Employers didn't help with out-of-pocket at all. You paid your co-pays, you paid your prescription co-pays, you paid any deductible you had. It was all on the employee. There were no HRAs. And as employers moved to HRAs in 2018, what my understanding is from talking to school districts across the state is that by and large, school districts gave the HRAs the same value HRAs to the different employee groups. So that going to that same out-of-pocket cost share that the Act 11 requires is actually not any different than the history, nor any different than state employees are treated. So that, that part would change. I would like to show you, if I can have the opportunity, that that health plans today, the health costs for employees today is actually less than they were responsible for in 2017. That all of the cost increases that have come from healthcare have actually gone to the employer side of the ledger since 2017. And I can give you some specifics on that if you would like. And I could talk on this for 3 days, and I know our time is limited, so I'm going to stop there for a moment because I'm.
Thank you.
Senator Terenzini.
Thank you, Senator Campion. I guess I have a question for the committee or the room here, but does anyone truly know, 2, 3, 5 years down the road, what does this do to the average Vermont taxpayer? I mean, I understand that the JFO has not done a full fiscal note on this yet. They may have, I heard, put some type of a briefing or memo together, but not a full fiscal note, from my understanding. And my question is, like everybody on this committee, I've received over the last few days a tremendous amount of emails from folks about it. And I guess I always come back when making a decision to what is it going to do to the average Vermonter and their tax dollars? Because we know that many people feel that property taxes are through the roof, and it's 85% of your tax bill is on the education side. So I don't know who I'm asking that question to. I just posed the statement in question to the committee to say, what do we know about this 5 years down the road?
Yeah, thanks for the question, Senator Terenzini. I'm hoping, first of all, Ms. Soares very well may also have a response, but I have asked Joint Fiscal to come in tomorrow and share with us what I think will now be a completed fiscal note. You're right. I think they've been sort of working on it. And I did invite them in tomorrow. So hopefully we will get a better sense tomorrow, which I think might help you and others with that. Ms. Soares, did you want to weigh in on that as well?
I mean, I think that you're correct that we need to consider the taxpayers' ability to pay, as well as maintaining high quality access to healthcare for school employees. One of the things that just was accomplished in the first round is that all school employees, regardless of position, have access to the same health coverage. So everybody has the employer helping with a family plan if that's what you need, and that was not always the case. Everybody has that employer help at 17 and a half hours of employment. So part-time employees have that help, and part-time employees get the full HRA value. So we've done some things to make sure that we've got equity and access for all school employees. And my worry is if this bill, Act 81, does not re-emphasize that has to be balanced against the long-term ability to pay, and that the arbitrator doesn't have to explicitly consider it, that we could have higher than needed property taxes for the foreseeable future. Now, again, if an arbitrator has to pick, they may pick the union position again, and that may be a very rational decision for them to make. I think that the argument is they need to have clear, explicit instructions to balance and consider all of these aspects, and that was missing in Act 11.
Thank you. Please continue, Ms. Soares.
So there were 4 things. I listened to the introduction of the bill before town meeting. There were 4 things I wanted to speak to. One is to talk briefly about the fact that, as I said, school employees are actually paying less for healthcare now than they were in 2017 as a group. And that all of the cost increases, and VHI has had double-digit increases for the last 4 years, has gone on to the employer side. And if you had taken the plan that most school employees were in 2017, it was called the VHP, and assumed just a 6 1/3% increase every year in premiums, which is sort of an average minimum increase in healthcare. And school employees were paying 17% of that health premium. They would be paying $250 more for a single plan than they are right now, paying 20% of the gold CDHP. And if they were in a family plan, they would be paying $420 more in a year than they are 20% of the gold CDHP. So people may be paying a greater premium share now, but they're paying less dollars in premium than if they had stayed in the old plan and it had been adjusted for 2021. Keep forgetting what year I'm in. In addition, as I said, all of the out-of-pocket costs would have been paid for by the employee. They didn't have any employer help with out-of-pocket costs in that health plan. But now, actually, and I'm going to share my screen, we know that all employees have access to an HRA. And this is an unlicensed employee and a single plan to show what they have in out-of-pocket cost assistance. It's really interesting to me, at least. So they have an HRA that's actually worth $2,200, represented by the blue bars. So the first, and the HRA has to be totally used up before the employee pays anything. And VHI pays for a lot of things itself, the health plan. So VHI pays 100% of all preventative care and screenings and wellness prescriptions. Then the HRA pays the first $1,800, the whole deductible of any medical or pharmacy care you need. And then VHI, which is the yellow, and the HRA split the next $2,000 worth of health or pharmacy benefits through coinsurance. So a single person would have to need $3,800 in health coverage before they start to spend any of their out-of-pocket. And then they would have a $300 out-of-pocket, but they wouldn't have the whole thing at once because they'd share the next $1,500 of cost with VHI, and VHI would pay 80% of it. So in order for that school employee to pay $300 in out-of-pocket, they would have had to need altogether $5,300 in healthcare. And that's similar, although I'm not going to go through all of it. It's similar for a family plan. It's similar for a licensed employee. So what that means is even if you are a unlicensed employee who needs a lot of health care, you've got a child with asthma, you have cancer, you have a premature baby, you're in a car accident, any of these horrible things that we can imagine that scare all of us at night, you have COVID-19, right? Even if you're had that, right now a single employee with premium at 20% premium share, even though many unlicensed employees don't yet pay 20%. I assumed a worst case. You pay 20% of your premium, you need to pay your entire out-of-pocket cost. You are going to pay $2,128 in the entire 2021 for all the healthcare you need. If you had been in that VHP, you would be paying almost $2,500 for that healthcare, about $350 more than you are now. Now, you think about how much you pay your family for your premium and how much out of pocket you might have to spend and see how that compares. An unlicensed employee in a family obviously has more of an expense, but they are still would not have to spend more than $5,660 for premium and maximum $600 out-of-pocket cost. And that would give them all the medical care they need in a year. So the exposure, the increases that have been happening have been shifted to the employer side of the ledger in the last 5 years. And that increases the burden on budgets, as Bridget talked about, and on taxpayers that the senator brought up. And also, as I said previously, school employees have never had out-of-pocket cost help from employers until 2018 when HRAs came on the scene. And most employers didn't differentiate HRAs by class of employees. Premium share, but not HRAs. So we have very generous health benefits available now. And as we talk about protecting employees, I think we need to balance that with protecting school budgets and protecting taxpayers. So before I talked about actuarial value, I wanted to sort of check in and see what your time frame was. I think it's 2:15. And you're on, yeah.
It is 2:15, and I do apologize that we do need to shift, but we do hope this is an important conversation, and one that we're going to continue after we take this shift over to S100. And I do apologize for the interruption. I know it's not ideal, but as I said at the start of the committee meeting, it's that time of year for the Senate legislature, and we have to get our lawyers and our people whenever we can.
Of course.
Ms. Soares, I do want to just end with one question, if I may, and that is, did you support last year's bill? The last year's bill as in...
Yeah, I know, 223 or something like that in the Senate.
Yeah.
I did not testify.
Yeah.
Personally, I did not, because I felt that it did not achieve the balancing that, and my hope had been the House would have picked it up, but then of course the virus has put everything on its head. So here we are.
Yeah. Very helpful. So we are committee going to pause. Again, witnesses, please feel free to stay on. What is coming up, I suspect, is also of interest to all of you. We are looking at S100, and I know that we are hearing from your representative in the building tomorrow. I believe Ms. Siglowski is coming in to talk to us tomorrow about S100. But if we may, I'd like to switch to Ms. Carby. Are you with us?
I am.
Great. Thanks for joining us. So, as I mentioned, or I don't know if folks know this, but Jim Demaray could not be with us at this point. So Ms. Carby is going to take us through S100. And then we are going to hear from Secretary French, and then we will hear from the bill sponsors. So with that, Ms. Carby, if you don't mind.
Thank you, Jennifer Carby, Legislative Counsel. And do you like to put the language up or just?
I think that would be helpful.
Pull it up and then, oh great, and Jeannie just made me a co-host. There we go. Can you see that language now?
Yes, and if I may, before you get started, for new senators, this bill again was voted out of the Agriculture Committee because there is overlap with the Agency of Education and education policy. It was directed to us. So with that, Ms. Carby, take it away.
Great. Jennifer Carby, Legislative Counsel. So this is S100. It was introduced by the Committee on Agriculture as a committee bill. And it is an act relating to universal school breakfast and lunch for all public school students and to creating incentives for schools to purchase locally produced foods. It starts out with a title for the bill, the Farm Fresh School Meals for All. And then it makes some changes in an existing subchapter of Title 16 on school food programs. The first changes, as I understand them, are just some technical changes in the definitions section. But the next piece, 1262A, adds in a new subsection D, requiring the Agency of Education from funds appropriated to it to award grants to supervisory unions and supervisory districts in accordance with what we'll look at under locally produced foods. If the amount appropriated is not sufficient to fully fund the grants, then the grant amounts awarded would be prorated. Then in the food program section of the existing statute, first, it requires under existing law, each school board that operates a public school must cause to operate within the school district a food program. This changes that to be specifically each school in the school district must operate or cause to operate a food program that makes available the school lunch for each attending student who qualifies for the free and reduced price lunch program every school day. And it directs school districts to maximize their access to federal funds for the costs of those meals. But then in addition, it also requires each school board to cause to operate within its school district the same school lunch and school breakfast program made available to students who qualify for free and reduced price lunches under the federal programs to each attending student every school day at no charge. So the upshot of this is that all students would receive at no out-of-pocket, no charge to them, breakfast and lunch at school every day or have access to. And to the extent that the costs are not reimbursed by federal or state funds or other sources, the costs for making those lunches and breakfasts available at no charge would be borne by the districts. It directs the school districts in operating these programs to seek to achieve the highest level of student participation, which can take different forms, might include having kind of grab and go or breakfast meals that can be picked up by students, making breakfast available to students in the classrooms after the school day begins, collaborating with the school's wellness community advisory committee, if it has one, in planning the school meals. And that's an including, so it could be other things as well. And then it directs the school districts to request that parents and guardians complete the household income form provided by the Agency of Education, which is used to determine the family's economic status to see if they are eligible for various state and federal programs. That's not required if they obtain equivalent information through another means, and you'll see later in the bill there is a way to obtain that information. Then it strikes through some existing language around purchase of local foods for school meal programs, but it actually moves those provisions and moves the date out a year in this next section. So it's not completely doing away with those, but really moving them and moving the date out. And so this would be a new section in this subchapter. Starts with a goal of the state that by the year 2023, at least 20% of all foods purchased by supervisory unions and supervisory districts, which it then goes on to call supervisory unions, would be locally produced foods. And in this piece, this part of this section, it gives the school boards discretion to define what foods are included in the definition of locally produced foods for purposes of subsections A and B, and you'll see there's a difference coming up for another section, another part of this. By on or before December 31st of this year, and then annually thereafter, a school board that operates a school lunch, breakfast, or summer meals program must report to the Agency of Education an estimate of the percentage of the cost of all foods that the school board has purchased for those programs that were locally produced foods during the previous one-year period that ended on June 30th. And then beginning with the 2021-22 school year and thereafter, supervisory unions would be eligible for a local foods incentive grant from funds appropriated to the Agency of Education for that purpose. It allows the supervisory union to apply for the grant if it has developed a locally produced foods purchasing plan that describes its goals for purchasing locally produced foods and its plan to achieve those goals. If it's designated someone to be the food coordinator for locally produced foods, who would be responsible for implementing the plan, that has developed a process to track the purchase of locally produced foods, and if it has complied with the reporting requirement that you'll see coming up later. The supervisory union that has satisfied those conditions may on or before January 15th of next year or on or before January 15th of any year after that, apply to the agency for a grant by submitting a certification signed by its business manager that it satisfies that list of conditions. If a supervisory union is eligible for a grant under subdivision 3, the agency would make the grant payment subject to appropriation by the following March 31st after submission of the application. So the application is due by January 15th. The grant payment would come by March 31st, which would be equal to 15 cents per reimbursable school lunch served by the supervisory union in the prior school year. This is a one-time grant, so a supervisory union can apply for this grant and receive the funding only once under this part of it. But then a supervisory union that has received a grant under subdivision 4, if they've received that one-time kind of gateway grant, then they may, on or before January 15th of 2023, the following year, or on or before January 15th of any year after that, apply for a further grant by submitting information to the Agency of Education demonstrating that at least 15% of the cost of all foods purchased or grown, raised, or produced by the supervisory union during the prior fiscal year, the one-year period ending on June 30th, were local to Vermont as defined in Vermont statute in Title 9, which has an extensive definition of locally produced or Vermont produced foods, excluding, so the things that would not count toward that 15% local, excludes foods that were purchased or grown, raised, or produced by the supervisory union that were used for catering services for which the supervisory union received compensation. So if they already got paid for those because they were part of catering, it would not count toward that 15% threshold. And also fluid milk would not count toward that 15% local threshold. If a supervisory union grows, raises, or produces food, it's directed to assign a fair market value to the food for purposes of reporting the cost. And then subdivision C here would require a vendor that contracts with the supervisory union to supply food products to certify which of its food products meet the definition of local to Vermont, taking into account those exclusions for what the catering and the fluid milk that don't count. If a supervisory union is eligible for a grant under this subdivision 5, then the agency would on or before the following April 30th after submission of the application, the one that's again due on January 15th, make the grant payment subject to appropriation, and the amount is determined as follows. 15 cents per reimbursable school lunch for supervisory unions purchasing at least 15% locally produced foods, 20 cents per reimbursable lunch for supervisory unions that purchased at least 20% locally produced foods, or 25% per reimbursable school lunch for supervisory unions purchasing at least 25% locally produced foods. It allows for us, so under this one, a supervisory union may apply for and receive grant funding for each year that it qualifies for the grant funding. So the first one was a one-time grant. This one you can get year after year, assuming you meet the criteria. And for applications covering the 2020-2021 school year, meals received through the Summer Food Service Program would also be counted for the grant payment. It allows the Agency of Education to perform sample audits for any year that it pays grants to supervisory unions to verify the accuracy of the information. If there is an over or under payment, then the agency can either seek reimbursement for an overpayment, reimburse the supervisory union for an underpayment, or adjust future grant amounts accordingly. It would require on or before January 31st, 2022, and annually after that, that the agency submit to this committee, to the Agriculture Committee, and to the corresponding House committees in an aggregated form, the information received from supervisory unions about the percentage of locally produced foods as the supervisory unions define them that were reported, and the percentage of the locally produced foods using the grant funding definition that were reported, and the amount of grant funding paid under that part of the program. And it would be an ongoing report. Section 1265, which would be repealed. There's currently an optional one-year exemption from providing food program that would go away under this bill. And then we get to definition of education spending, section 3 of the bill basically just says costs incurred by a school district or supervisory union to provide school breakfast and lunch don't count toward the excess spending cap. So they don't count toward the cap in determining whether a district has exceeded the excess spending threshold. Section 4 would direct the Secretary of Education to come up with a definition of student poverty for purposes of determining qualification for federal funds by school districts, establish the data that school districts need to collect to qualify for federal funds based on student poverty, and how to collect the data and how often, and determine how that information would be reported to the Agency of Education by school districts and how frequently that reporting would occur. And it requires the districts to collect data that is necessary to qualify for federal funds based on student poverty and report the data to the agency in accordance with subsection A. Section 5 is a section that would specify that a school district must count time spent by students consuming school meals during class as instructional time. Section 6 is a transitional provision so that the provisions of subchapter 2, 16 VSA chapter 27, subchapter 2 would take effect over a 5-year period, would allow time for the school districts to come into compliance with it. And then we get into a number of appropriations. So this one gives $1 million from the education fund to the Agency of Agriculture in FY22 for the farm to school program in Title VI. The funding would be used to award grants during that 5-year transition period to school districts that are transitioning to making available these school breakfast and lunch to all students at no charge. And it would direct the agency to establish criteria for awarding the grant funding, which might include funding for any or all of the following capital expenditures, including equipment, staff support, administration, and training. And it requires each school district that gets a transition grant to use the funds to pay for the cost of transitioning under the subdivision and report to the Agency of Agriculture how they use the funds. Any unused funds would revert to the farm to school program. Section 7 creates a new position in the Agency of Education, a full-time classified position specializing in administration of school food programs. It would be transferred and converted from an existing vacant position, and it appropriates $100,000 to the agency in FY22 for the salary, benefits, and operating expenses. Section 8 directs the Agency of Education to collaborate with the Agency of Agriculture to promote the local food program to supervisory unions, supervisory districts, farmers, food processors, and distributors. Section 9 appropriates $500,000 to the agency in FY22 from the general fund for local food incentive grants under that locally produced food section. From the appropriation, the agency may use up to $60,000 to hire a contractor or otherwise fund implementation costs, assist with developing and establishing the local food incentive grants. It also appropriates $500,000 to the Agency of Agriculture from the general fund in FY22 for the farm to school and early childhood grant program. And then finally, it directs the Agency of Education to make an annual budget request for $500,000 for the local food incentive grants that were added by this act. And the act itself would take effect on July 1st.
Thank you, Ms. Carby. Sounds like an ed bill, more than an ag bill in a lot of ways. Committee, questions? Let me just kick it off then. What are we doing right now, Ms. Carby, as it relates to school lunches and breakfast? What is the status of that in the state?
So I'm happy to do the walkthrough. I'm not sure I can tell you much about, I can tell you what I understand from Jim, which is that we do free and reduced price lunch, which results in no charge to the student who's eligible for those, because either the federal funds or the state picking up the student share for the reduced price.
Yeah. No, I appreciate that. And I know Secretary French is next and will be able to answer a lot of these questions that we might have. Then any specific questions as it relates to the walkthrough itself and the language in the bill as presented by Ms. Carby. Senator Persley, please.
Just a quick question. Is there a section by section? I know it's something we produce like when it passes out of the committee to the floor, but just as a first look through, that would be a helpful way, because there's a lot going on there. So
It's a great question. I'll look in our system and check with Jim. Typically, we produce them on request. So if nobody had requested, it may not have been created yet.
well, if there is one, it'd be good to see, but thanks.
And committee, know that Mr. Desmarais is planning on joining us, as I mentioned, at the end of the day today to start to look a little bit at S13 strike all. So we might have him for a little bit to talk about this as well. Anything then for Ms. Carby? Yes, Senator Terenzini.
Thank you, Senator Campion. Jennifer, good to see you in the afternoon.
Yes, you do.
A couple quick questions. So this bill, if I'm understanding correctly, would call for to be funded each year from here on out with $500,000 annually, correct?
It would direct the agency to include a $500,000 request in its budget proposal and its budget request to the General Assembly. It would then be up to the legislature to decide how to fund that.
And one of those funding methods obviously is to raise taxes, right?
That is a way to create revenue to spend. Yes.
Okay. All right. I mean, I'm just trying to figure out, and I guess Secretary French probably can during his presentation, but I guess the next question of mine would be how much of this program do we expect to be funded from the feds versus having to raise taxes on Vermonters? So.
It's a great question. I don't know if the committee has requested a fiscal note on this or not, but it's something that we can learn, I'm sure, more about. Actually, I think we might be hearing more about the fiscal note tomorrow, as well as hearing more about H81. Any other questions then for Ms. Carby before we move on to Secretary French? Jen, thanks for jumping in. I really appreciate it.
Sure. And I'm just going to hang out with my video off and listen.
Okay.
If you have more
great.
questions for me, I'll be here.
Great. Mr. Secretary, thanks for being with us this afternoon, which looks like you'll be with us quite a bit this week. You might just want to stay on Zoom in this committee. I know you've already been down the hall, if you will, into Senate Agriculture. And what we would like as much information from you as it relates to the bill, some of the things that you might agree with, your concerns, where your support or lack of support lies at this point, and a little bit about, if you don't mind, you may have heard my question to Ms. Carby, where are we now with free breakfast and free lunch, and where will this put us? So with that, the floor is yours.
Well, good afternoon, Dan French, Secretary of Education. It's good to see you all. Appreciate the opportunity to testify. I am struck as Ms. Carby was going through the bill and the magnitude of what's here. I'm not unfamiliar with these issues, either as a superintendent or secretary. But what's being contemplated here is pretty significant shift in policy, and there's a lot of work to do. And I know it sounds like a broken record, but my immediate reaction just listening to that summary is that I'm not sure how we're going to take this on as a major initiative in the context of everything else that's going on right now. But I'll qualify my remarks a little more specifically to a couple elements of the bill. And I think you've met our sort of exemplary food service director, Rosie Kruger, who's really, I would say, a national expert on some of these issues. And if you haven't heard from her yet, I'd suggest you might want to invite her in to come in and speak at some point. But before I go through this, I'll just answer your question directly, Senator, on where are we now. particularly relative to COVID, because we had some news actually around noon today that the U.S. Department of Agriculture is going to extend the free meals through the summer, actually through September 30th. So that's all good news. So under COVID, we've been able to operate these programs essentially nonstop since last March, and it's put tremendous strain on our system, but also its work. I would say that's been hugely successful at the local level, and everyone's so many different partners committed to feeding kids during the pandemic. So it was good to hear the U.S. Department of Agriculture has extended those waivers. I would say in terms of the past year, it hasn't always been necessarily a positive relationship with the U.S. Department of Agriculture. It's taken a lot of work from them, no doubt, but also from our staff and the staff of other states to be very persistent and aggressive in obtaining the necessary waivers to feed kids during the pandemic. I think at one point, I want to say around August 1st, we were up to about 34 some odd distinct waiver requests of regulation in order to keep these programs operating. So it has not been easy by any means, but we certainly appreciate the extension through the summer and September 30th. It gives us a little breathing room.
And just
Specifically,
for clarification, Mr. Secretary, is that free breakfast and lunch that Department of Agriculture is doing?
that's correct.
Okay, thank you.
The in terms of specific aspects of the bill, and once again, I am sort of taken back a little bit this afternoon in the scope of what's being contemplated, but I thought I would focus in a bit firstly on the local foods component and then talk more specifically about universal meals. In terms of the local foods, I am struck by how complex what's being proposed here. We've certainly support and have been quite successful, if not a national leader in terms of farm to school and so forth in Vermont. It's just what's being proposed here is exceedingly complex in terms of a grant program to administer and so forth. We think a far simpler approach would be just to appropriate additional funds on essentially a per plate basis and award those funds to districts in that regard. And we could come up with some softer ways to encourage them to spend those funds. So we would expect, the additional funds would be welcome to do that. Unfortunately, I think what's being proposed is very cumbersome from a process standpoint and would be very difficult for us to administer. And especially in considering the complexity of the regular program that we're already administering, I would seek for any opportunity to simplify what we're not doing, not to add more complexity, and albeit much of the complexity we have is inherited from the federal government. And then in terms of universal meals, I think once again, there's broad support, I think, for the concept. There's a couple really pivotal and foundational issues that we really struggle with on this. And I would say it's not just Vermont, it's a national issue. This idea of using the free and reduced lunch percentage as a proxy for poverty. And it, as you know, this is a program that's administered by the U.S. Department of Agriculture, but in education, in the U.S. Department of Education, we use that percentage for so many different things. And it's not as simple as just abandoning that percentage, unfortunately, because we are reliant on it in so many different areas. I was thinking, the conversation in the press conference today around broadband, school districts pull down significant federal dollars in the form of E-rate to support their use of broadband. And one of the percentages or factors that contributes towards their reimbursement rate is the free and reduced rate in their district. So we have to be very cautious about abandoning this percentage, as imperfect as it is, because we use it so often. So we're concerned that abandoning the rate that we have now and could cause repercussions in other areas. And I know this proposed bill directs me to solve that problem, but I can tell you it's a subject of much debate at the national level. For 6 years, when I was superintendent, I served as the Vermont representative to the National Center of Educational Statistics Forum, which ponders these kinds of issues. And the forum has produced guidance on alternate indicators that basically say there is no simple solution. So I appreciate your confidence in my ability and the ability of our agency to puzzle our way through this, but I can tell you it's not a simple issue, and it gets into tax information and so forth that is not easy to collect or as convenient to collect anyways. What we have now is imperfect as it is. So I would, the funding issue is a key piece. Part of it's on how the function of the ratio currently works relative to other programs that we operate and so forth that districts really need. We do have a cost estimate in there. I know you had asked about, what are we looking at? We have a projection of 50 million to make this work. And there's the JFO might have a smaller number on that, but you could dig into that. I think some of that analysis has been done. And then, this, as I mentioned, this issue of data as a metric is problematic, and we think we really have to be cautious about just jumping into this without having that problem solved, because it's going to create significant ripple effects throughout many of our other programs. So we support the idea of universal meals. Just comment, and particularly the local foods piece, which I think we've been a national leader in. I think what's being proposed here is complex in terms of local foods. I think the universal meals, we need to answer the questions about the impact on funding for other programs and some other proxy indicator, if you will, for poverty that's been critical in our data collections. And I would be cautious about Vermont creating its own version of that without consideration of how that might impact our relationship with federal data collections. But then lastly, just as I mentioned as I started, I question the complexity of this bill and what's being asked everyone to do. If there was nothing else going on, I would say, wow, this could be the sort of flagship policy of our time. But unfortunately, we have so much in flight already pre-COVID, but certainly the COVID recovery, not to say that feeding kids isn't going to be a critical piece of that, but everything we need to do in the next 6 months to a year needs to be framed about, from my perspective, of mitigating the impact of this pandemic on the lives of kids. And that's going to take some while to unpack a little bit. So I'd be really cautious about anything, even as laudable as this effort, that might be a distraction on our capacity to support districts in that regard. And as you know, there's several other initiatives that the General Assembly is being contemplating as well. So it's, I think we need to do our best to keep a focus on the COVID relief and the recovery work as best we can. So I'll be happy to answer any other questions.
Senator Karanzini, is your hand still up, or is it up anew?
No, that's a new hand up. Thank you. Thanks for calling on me. Secretary French, you a few minutes ago mentioned a number of, did you say $50 million?
Yes, I did provide written testimony, so you can see that summarized in there, and some conversation about the analysis the JFO has done versus our own analysis. But that's a number we've worked out with some of the advocacy groups as well. It's more or less a worst case scenario, if you will.
Oh. So I hate to just ask these basic questions, but what does the $50 million get us? In other words, this bill proposes $500,000. What are you referring to with $50 million?
Well, it'd be the cost that we'd lose in revenue, and there's also going to be cost to expand the program. Right now, as I mentioned, the federal government is waiving the cost of meals essentially through the end of September. But if we were to pick up the tab for that on ourselves as a state, that's basically what we'd be looking at.
And that 50 million represents over how much time? That's not per year.
A school year, we believe.
50 million per school year.
Yes.
Okay. I just can't. I'm sorry if I sound shocked here, but it's hard to wrap my head around $50 million.
Yeah.
For lunch, breakfast and lunch for school kids.
Yeah, I mean, I would encourage you again, if you're interested in probing this and down to that level of detail. We have a lot of staff capacity to analyze these from a policy perspective, these types of proposals, and I know our advocacy groups have as well, and the JFO has been involved. So you should, feel free to unpack those in more detail with bringing in those technical staff. I have unfortunately a superficial knowledge of most education policy issues, but you should bring those folks in for sure.
Thank you.
Thank you. Senator Perchlik.
Yeah, thank you. I just had a question on, can you remind, I know we talked about this last year, but remind me, Secretary French, on how eligibility right now for the free and reduced lunches are determined? Does each school have to do that to each child, or how's that done?
Yes, there's a certification process at the local level, and that breaks down into a couple different levels. There's this idea of direct certification, If folks are eligible for other federal assistance programs, a district would receive notice essentially that these folks, because of their eligibility for another program, are automatically qualified. And I should say this process begins at the beginning of the school year every year. Students inherit their eligibility from the prior school year through the month of September. Which is one of the reasons I think the U.S. Department of Agriculture just announced this extension through September 30th, because that's sort of the grace window, if you will. So we add the idea of direct certification. If students are eligible or families are eligible through other programs, then they're automatically eligible for this program, either free or reduced meals. And then there's an application process for everyone else. So to fill out the application, there's a couple methodologies by which a family could qualify for free and reduced meals, either an income methodology, for example. They could produce paycheck copies or copies of their paycheck. They could bring forth other income, and there's a certification process at the local level, essentially a certification officer, generally speaking, usually the food service director. And those applications are certified at the local level, and an eligibility rate is then determined. And then periodically, our state folks go in and audit that eligibility process to ensure everyone is, that's being followed closely. But it's essentially a local process.
Project follow.
So, but they're following some federal guidelines about, they're making the determination if they hit that federal guideline or not, right?
That's correct. I mean, it's all prescribed. There's a certification handbook, methodology has to be implemented. And when we go in and do that audit, it's essentially to ensure that those compliance pieces are being followed. And then as part of the audit process, we also go out and sample folks in the community to make sure that, everything's been operating accordingly in terms of communication, letters to families and so forth.
And is it done on a district level or a school level?
Yeah, that's a subtle change. For the most part, under our regulation, it does reside at the school level. But then at one point, I was just saying under Act 153, we created the virtual merger provisions where we moved some things to the central office by law. Food service was not included in that. But at some point, maybe 4 years ago or so, the agency basically said, we're going to establish a food service authority at the district level. So that's sort of a recent innovation. And it sort of supports, I think, the trajectory under Act 46, where we're moving some of these functions to the district level. So I know I just gave a subtle answer to that, but where we are now, it's essentially a district level function. But there's still some underlying tension between schools and districts in terms of administration of the programs. Tension, not in a negative way, just, it's a complex program to run.
Senator Hooker.
So thank you. And thank you, Secretary Franklin. Can you just elaborate on the impact that the Universal School Meals Program would have on the funding based on poverty? Can you just explain to me what would go on if this program were to be in place? I mean, wouldn't we still have you've talked about other ways of certifying that people are meeting the eligibility of the requirements, but what would happen if this program goes in place, and why would that change things dramatically?
Yeah, I think, it's problematic on a couple levels. Essentially through, as I just described, sort of that certification process, a district's rate of free and reduced is established. And then that rate is used as a proxy measure of poverty in many other areas. The example I mentioned, E-rate, for example, or title grants. We rely on that percentage of eligibility for so many different aspects of federal education funding in this country. And so anytime we move away from this has sort of been the national conversation. How do we abandon essentially what is a very convenient measure, although a very imperfect one, when so many of our programs are dependent on it to determine poverty in communities? So no, from my perspective, this is a national issue that's being debated between the U.S. Department of Agriculture and the U.S. Department of Education. There has been no simple solution coming down from the federal government on how to do this. So my point is, it's not as simple as just Vermont doing it itself. There are implications both from a financial perspective and a data perspective that need to be contemplated. And it's really been the chief stumbling block for us to move beyond just our advocacy for feeding kids in a universal way to actually figuring out a way to enact it, because it puts other things in jeopardy that are pretty significant.
Okay.
So essentially, we would not have a rate of participation. And when it comes time for districts to apply for other things that require that rate, I'm not sure how we would respond.
Okay, because everybody's eligible.
Yeah, essentially everyone's eligible. There is no application process at that point if it's universal. And what's in our written guidance, some of the analysis we've sort of looked at is, okay, so what's the motivation? We could contemplate some other application process to determine a rate, if you will. But what's the motivation for people to complete that if they're automatically going to be eligible? It's why would I complete this paperwork and disclose my income, for example, when I know I'm already going to be eligible under the universal program? So that's the challenging piece that we haven't been able to figure out.
To get money for other programs, I guess.
Yeah.
That would be the reason.
Yeah, it's unfortunate. Again, I've been at some of these conversations at the national level, and it's as I mentioned, we've had to apply for so many waivers this year. The U.S. Department of Agriculture administers these programs. These programs were established out of a very specific historic trajectory out of agriculture, and we've become dependent on them to a large extent, statistically and otherwise, in the education policy area. But my impression at the national level is they don't necessarily talk to each other, and we get caught sort of in between. And I think, again, Vermont's been a leader on many of these issues, and even as a leader, we find ourselves often in conflict with the policy and regulation, and have to really be on the cutting edge of pushing those barriers to get what we need to happen for kids.
Thank you.
Mr. Secretary, I'm wondering if this bill were not to go forward this year, what could we do, given the federal dollars coming in, to make certain that, let's say, it's pushed out a year, 2022. What are some of the things that, is it possible for us to still provide universal school meals from end of September through the academic year, given some of the federal dollars coming in?
Yeah, I mean, I can lay out some scenarios for that, and particularly talking about what we call ESSER funds, the elementary, secondary education relief, emergency relief funds, which, districts, firstly under ESSER, districts have the authority over 90% of that funding. So they direct a lot of how that money gets spent. So the first thing would be, we would need to encourage essentially districts to attend to this type of program. And to the extent this type of program would be permissible as a COVID use, that rationale would have to be developed. So to what extent could districts spend the money they're going to receive under ESSER on universal meals? They will need to be able to make the connection between universal meals and COVID, which can be done, I think, fairly easily per se, but it's something that still would need to be developed. But the point is, the districts control that funding. It's considerable funding, but they're also going to have other priorities. They're going to have priorities like mental health and so forth, which is why in our recovery work, we want them to go through a prioritization process. But conceivably, they would have funding to address some of these issues, and I don't know what that would look like at the local level. But my guess would be, based on my own experience, that they would seek to put money into things that have been working pretty well. And we have very strong partnerships on farm to school at the local level. A lot of partnerships with local producers and so forth. I think they would seek to, keep building those structures out with these dollars. But on the other hand, these are one-time funds, so it's hard to say at this point. But ESSER, that's an example of how ESSER could be utilized.
Okay. Senator Persley.
Yeah, and maybe my question, are we hearing from Senator Pearson, or is he just stalking us in our committee?
We are hearing from Senator Pearson, but given schedules, we're hearing from Secretary French first. Okay,
because I think some of my questions are kind of like what are probably better for the committee that created the bill than for French. But maybe one question that the Secretary does have is, do we know what the current rate is of those that are eligible for the current reduced meals take it up? Like for other programs, we usually have a ratio, like we know how many people are using the program that they could qualify for it. Do we have that data, or do you know?
You're asking what are the eligibility rates currently for the program?
Like percentage wise. So if we knew there was 100 kids that were eligible, but only 90 signed up to get it, that we'd have a 90% take up rate kind of thing.
Yeah, I mean, I guess the only indicator we would have is what we have now for free and reduced. And certainly, again, I think, my program staff could come in and speak to you about, you're asking basically what would happen if this was opened up, and what would be the motivation of people? To what extent are the current processes a barrier?
Well, I'm not asking that. I'm just wondering, the current program, how successful it is reaching the people that need it. Like, are there some people that need it or eligible but don't sign up for it? Like, that happens with other programs.
Yeah, I think there's definitely some of that. And I think, it varies from community to community. So it's hard for me to make a general statement about it. I think there's, I think you're probably familiar with the community eligibility. There is a process by which a district can sort of determine that everyone in the district is eligible without, individually having that certification process go forward. So there are communities that are able to operate that way, and they could certainly provide you some testimony on how that's working. But I would just, I do want to reinforce, I think, sort of my new aha today, that what's being proposed is exceedingly complex at this given moment. It's not so much just looking at it on paper and reading through it. I think we have to think about what's being contemplated relative to the COVID moment that we're in. And there's going to be a lot of changes in education policy. I don't think we fully contemplate, both from the federal government and at the state level, as a result of COVID. So I'm kind of being cautious, and I don't think overly cautious, about thinking about our capacity to take on a major initiative, a complex major initiative, simultaneously with just really being focused on what the impact of the emergency has been on our kids, and being able to support districts and being responsive to those very specific needs in their communities.
Thank you. And I believe, Secretary French, we have to leave it there with you. I believe you have another commitment, but we certainly appreciate your time. I know we'll be seeing you tomorrow, probably Thursday and Friday and Saturday and Sunday. And
happy to help anytime.
No, we really appreciate it. Thank you.
Take care.
Yeah. Senator Pearson, thanks for joining us. You've been here for the conversation, which is great. Why don't you start by telling us the genesis? Are you the bill sponsor, or is it a committee bill?
It's a committee bill, and it picks up on a bill that was, I think, also a committee bill last year around the local food incentive that, was underway just as we all had to go home. So got left on the drawing board.
Great. Why don't you've heard a lot of the concerns.
Sure. I'd be glad to try to help you.
That'd be great.
For the record, Senator Pearson from the Chittenden District, and one of the reporters of this bill, which passed out at Committee 5-0. The Secretary talked about the COVID moment, and I think that is a very useful frame as we approached our work, which sort of started more focused on the local food piece of this, which you might expect out of the Ag Committee. We have seen all of our schools, as the Secretary just reaffirmed, delivering universal meals. That has been a shining light as an example, something we can be proud of. Our folks at the district levels have worked incredibly hard. We've heard stories of teachers driving and delivering meals. It's been something that, to my mind, has been very exciting, and something that really reflects well on the community of Vermont. We have been delivering throughout the pandemic, and as I just learned, we'll go through September with a universal meals program in our schools. And that's really important because on a given pre-pandemic, we had food insecurity rates in Vermont of about 1 out of 10 people. And data coming out of UVM is that the current rates of food insecurity is 1 out of 3 or 1 out of 4 people in Vermont.
And just for clarification, you're talking about school-age children.
I'm talking about people in Vermont that report as being food insecure.
You have those numbers K through 12?
I don't believe we have that data. The UVM has been in an ongoing way measuring this, and I encourage you to talk to people from Hunger Free Vermont. So, you know, I think about that. 1 out of 4 Vermonters expressing food insecurity. That doesn't go away a month after the emergency order is lifted. And certainly in our caucus, we have spent a lot of time agreeing that we wish to see if we can address food insecurity. So then I'll just first take the local incentives piece of this bill, even though it's second, if that makes sense. What we did there was, it's interesting, the secretary wanted it to be more simple. We tried to simplify it. Rosie, out of his shop, asked for it to remain in the structure that we had here, and it was actually the structure we worked on building last year with her, because it better reflects the current status in our schools. Okay, schools are already got a designated food sort of overseer. They already define local foods, which is why we don't transition until after the first year. There's already, as Secretary said, successful farm to school programs. Those have been basically, in my mind, driven ad hoc by school, you know, maybe parents approach the school board decides to do it, or food director decides to take it on, and then the state has good grants that come in and support them. It's time to take that to the next level. It's time to not be dependent on, hey, we've got a great lunch director and they're willing to do this, and to really standardize it. So we started looking around the country. Michigan, New York, Oregon, all have something akin to this local incentives. And in New York, the data is off the charts how well it's working. Every dollar you put into local food, you're getting about $1.60 back in reverberating around the economy. In New York, what they're seeing, they peg their percentages higher than we're contemplating here. You have to hit 30% of your food to be local in order to get a 30-cent increase. They're seeing some schools be up over 60% local foods. They are seeing markets being created because they have used this program now for 2-3 years, and it's dependable, reliable, and consistent. And so businesses are stepping in. That to me is very exciting when we try to stimulate the local ag economy. So we're building there off of successful programs, not overly cumbersome. They're road tested, even just across the lake in New York State, being done there. We phase this in so that schools can get up to speed, but some schools that are in already doing it, many of our schools will be over 20% local already. They you know, can go a little faster, but so you'll see the tiers in there. We didn't want, because of this gets trued up at the end of the school year. So if a school, for instance, in New York, they said, if you're hitting 30% local, we'll give you 30 cents a meal. At the end of the year, if they come in at 29%, they don't get anything. And that didn't seem fair to us. And working with Rosie and other advocates in the farm to school world, we like the idea that there be a catch-all. Well, we're aiming for 25%, and therefore 25 cents a meal, but we only got 24%. So we'll still honor that you're buying more local than you were last year, and we give you a 20-cent per plate incentive. So we like that. It's based on successful programs elsewhere. It's smart for our economy, and it's building on something that works. But it's the local food structure has not been. It's not got a system. It's not systemized in that sense. I talked to a principal in Essex who buys maple syrup on his way into school, puts it in the trunk of his car. That's not what we're talking about, right? We need to move beyond that. So this is an attempt to do that. When we dug into it, we were learning, of course, about the current status of universal meals being across the board right now, and wondered if we could continue that. And I was interested to hear the secretary did not mention, we have 70 schools today, and in many cases for decades, that are delivering universal meals. So it's not some unimaginable bureaucratic process. We already have it in 20+% of our schools. We have universal meal program in New York City. So the millions of people that live in New York City have found a way through this paperwork challenge that the secretary seems to say is insurmountable. I believe they just collect household income. And there's no way New York City is leaving behind federal dollars in order to feed everybody in New York City in their school program. So the bureaucratic challenge, I'm not saying the secretary is just totally wrong. We've heard very consistently that this is a challenge, but it's being solved in New York City. It's being solved already in 70 of our schools, and my own school district here in Burlington for 20 years now. They've had universal meals. So there is some ability to get there. You heard the secretary say that their estimate is $50 million. That is based on, according to their testimony, if every kid in the state, in every school district, took every meal they could. But it ignores the fact that we phase this in over a number of years, and it ignores the very data that's coming out of the 70+ schools in Vermont today that have universal meals. So when you extrapolate what's been happening in the schools where we have universal meals, your estimate is closer to $20 million. Now, $20 million is nothing to sneeze at, but again, this is over up to 5 years. And $20 million out of a budget of $1.5 billion of we pay for schools, I think needs to be in the context of what other strategy do we have to deal with the 1 out of 4 Vermonters expressing food insecurity. So we have consistently heard from the Agency of Ed that they support this goal and that they have concerns. We heard that last year when we started our conversation about the local foods. We've done more work, admittedly, on the local food incentive, directly working with all of the people, and there is a state infrastructure to help with that between the Agency of Ag and the Agency of Ed. We heard consistently since last year, and then more as we dug into the details of a universal meals program from the agency, that they support this goal. They did not come up with any alternatives for us. And that was a really tricky part, because we're very open to working with them, making it as simple as possible. We want this to work. And yet, for some reason, they're not able to come forward with solutions. We've been delivering meals to our kids today. When the pandemic ends, the hunger and food insecurity is not going to end. And I would be proud of us leading this charge and saying, you know what, we're going to feed our kids. It's pennies on the dollar compared, not even, it's fractions of a penny on our education dollar. And it just takes care of a basic need. And we're trying to say, let's do that in a way that also stimulates our rural economy, gets our local food into our local schools. And I should say, by the way, the farm to school program that we have is the envy of the world. It's time to take it to the next level of the country, maybe not the world. It's the envy of the country. And up the hill for me at UVM, one of their food contractor is Sodexo. Now, Sodexo took a lot of heat in the last decade about their desire to have local food and whether or not they were doing enough to stimulate local ag. At UVM, they buy 20% of their food locally. This has a huge impact on our economy. And what they'll tell you anecdotally is the reason that program is still continuing is the Vermont kids that came through schools where they had a strong farm to school program, and they look around the cafeteria up at UVM and want to seek out the local food. And the farm to school program is just some of the greatest testimony I've heard in my entire time in the legislature, because it's not just getting the local produce in the salad bar. It's often gardening. It's using math as your gardening. It's hosting parents for a community night to eat, including eating the food that they've grown, baking bread and serving it to their parents. There's just tons going on here that's well beyond just the farmer down the road gets to bring you his carrots. There's really, really positive things, and I think it's time we build on that. I'm not oblivious to the challenges, fiscal or otherwise, but I hope we can advance this and punt it to the folks in appropriations to see if they can come up with the money.
Right, great. Thank you. Questions for Senator Pearson? Senator Hooker, please.
Thank you. Senator Pearson, the secretary said $50 million a year. You're saying $20 million over 5 years?
No, I'm saying no. $50 million assumes every school has it and every kid takes it. Mm-hmm. We have 70 schools that have had this in many cases for decades, and 100% of those kids don't take this. So I'm saying that it's just silly to extrapolate from 70 to all 280 of our schools and assume that you ramp up participation. So when you take and you extrapolate their experience, the budget total is in the neighborhood of 24 million, and I believe Joint Fiscal is trying to tune that number up, but it's in the 20s. Also, our bill doesn't contemplate universal meals next year. I'd be open to that, but it doesn't. It phases it in over 5 years, recognizing that not everyone's going to be able to do it in 1 year. Right. So it's not 50 million, it's closer to 24. It's not 24 in year 1. If you get there by year 5, then you're probably looking at something like $24 million.
Thank you.
A year.
Yeah. Senator Terenzini.
Thank you, Senator Campion, and Senator Pearson, thank you for your information. I love the idea of the buying local, supporting our local farmers and growers. It's a great concept. I want no child to go hungry, in our schools, but so we fall somewhere between 20 million and 50 million a year out of 1.5 billion. You're right, it doesn't sound like that much, but I still get hung up on the fact that we're probably not going to cut another program to offset the cost of this. So we're going to have to increase the overall budget, in my mind, by 20 or 25 or $30 million to support this program annually. And again, coming out of COVID, hopefully soon, with restaurants and bars and so many industries just devastated over the last year, I don't know how I can go back to my constituents and say, I just voted to support something that's going to possibly raise taxes by 20 or $30 million a year. And that's the sticking point for me. So that's where I'm at. I appreciate your testimony. It's a good concept. I just don't know how we can afford it.
I guess I would offer that, as we've seen in the last year, I sit on Senate Finance. A year ago, we were told that the Ed Fund had a deficit of $150 million. Now the Ed Fund is running a surplus. Turns out people like ordering from Amazon during a pandemic when they're locked at home. So the sales tax is outperforming any estimate that we've had. So I don't, it's just not as simple as saying, pass this bill, increase taxes. Pass this bill, there could be an increased cost, yes, but it does not translate to an automatic tax increase, far from it. The other reality is, there's an efficiency of feeding kids in a more holistic way, right? I mean, now they're not bringing lunches, so you're not inventing new costs. You're maybe shifting around how it gets delivered.
Final question for Senator Pearson, knowing that we have witnesses, and I do want to give colleagues a break. I know we've been here almost 2 hours. All right, I think we'll leave it there. Senator Pearson, thanks for coming in. Very helpful. To our witnesses who are here to continue the conversation on H81, if you wouldn't mind, we are going to just take a break until 3:30. Senators have not had an opportunity to do so. So we will see you all at 3:30, and then we will be with you, I think, just about until about 4:30, when we will continue our work or pick up our work on S13.